Hi, first of all, thank you for showing an interest in my work. My name is Gerald Renten, and I will talk about my work, which is titled Neural Correlates of Transcutaneous Vagal Nerve Stimulation, Effects of Anatomical Site and Waveform Parameters. For this work, I have nothing to disclose. I will start with a short introduction. So VNS, or vagus nerve stimulation, is a type of neuromodulation involving the vagal nerve. The vagal nerve is part of the parasympathetic nervous system, and stimulation of this nerve was traditionally done invasively via the neck. And this type of VNS can, for example, be used as a treatment option for epilepsy to inhibit seizures. In contrast, transcutaneous vagus nerve stimulation, or TVNS, is non-invasive, and it's a non-invasive stimulation of the vagal nerve, and it can be done via the neck or the ear, but it doesn't penetrate the skin. It has been previously shown to be successful in, for example, depression, cluster headache, tinnitus, and visceral pain. However, in current TVNS research, there is little to no consensus on the stimulation site, so the ear or the neck, or auricular or cervical, and the waveform parameters. So for example, you could use a fixed or a variable frequency. Therefore, in this research, we will aim to explore the effect of TVNS with different anatomical sites to stimulate and different waveform parameters using either the fixed or the variable frequency. Therefore, 15 healthy controls are included, all female and with a mean age of 24 years. All participants underwent 7T MR scanning, divided into 2 sessions. To explore the effect of TVNS, a functional MRI scan was used, and the scan parameters are shown on the slide here. And the slices were tilted in such a way that the brain is fully covered, the brainstem is fully covered, since this is an important part of the parasympathetic nervous system. And additionally, for anatomical reference, an MP2 rage scan was added to the protocol. And like I said, there were 2 sessions, one with the auricular stimulation and one with the cervical stimulation, and to ensure that the effects of the prior stimulation are completely washed out, the scanning was done in 2 separate scanning sessions with a 2-week washout period. So for each stimulation, there was a block design with, for the TVNS, I was done using a block design with periods of 60 seconds rest and 60 seconds stimulation repeated for 5 times. So in total, the scan was 10 minutes. And during one of the sessions, it was applied cervical, and during this session there was also a sham condition, which is a stimulation on the hand. So in that case, the vagal nerve is not being stimulated. And at this session, there will be a fixed and a variable frequency. And during the next session, or the other session, the TVNS was applied auricular. And for each participant, the order of the scans in each session, as well as the order of the sessions themselves, were randomized. So the cervical session was not necessarily the first session for all the participants. The fMRI data was pre-processed using a relative standard pipeline. So first, using reversed phase encoding scan, we corrected for EPI corrections or geometric distortions. Subsequently, we corrected for slice time correction, subject motion, and we registered the images to MNI space using the anatomical image, which was also acquired. And we used the anatomical component correction to make sure that we remove any nuisance from the signal. And finally, some spatial smoothing and bandpass filtering to only select the neuronal frequency band. So these are the results, and these results are depicted as with respect to the sham condition. So what is shown is the significant difference compared to the sham condition. And we can observe that for the cervical fixed frequency session, that there is some positive correlation with the bolt signal and the stimulation in the brainstem, while for the variable frequency, we observe, at least in the brainstem, it tends to be a more anti-correlation. And furthermore, there are some widespread differences throughout the brain. Interestingly, for the auricular stimulation, we observe a different effect or an opposite effect. So with the fixed frequency, we see, even though that is less pronounced, but we see more a anti-correlation with the stimulus in the brainstem, while for the variable frequency, it's a small region, but we see a positive correlation with the block form or the stimulation for the variable frequency in the brainstem. Instead of looking at the activation maps, we could also do a region-based analysis, focusing on the thalamus, the insula, the anterior cingulate cortex, and the NTS of the brainstem. These regions are all important regions of the parasympathetic network. And in this case, we calculate the average activation or correlation with the stimulus and compare that to the sham condition. This shows that the activation of the thalamus is significantly reduced using the auricular stimulation with either the fixed or the variable frequency, and also for the cervical stimulation with the fixed frequency. Moreover, a trend towards an increased activation in the insular cortex was found for the cervical stimulation with a variable frequency. And besides these results, there were no other trends or significance results found. And this shows that on the one hand, there are similarities between the anatomical site and waveform parameters, but on the other hand, also key differences. So to conclude, the cervical stimulation appears to have the highest activation changes in the brainstem. And the region-based analysis showed that mainly the thalamus is modulated using the auricular stimulation and also using the cervical stimulation with the fixed frequency. And further work should go beyond just region-based analysis and also focus on the functional network as a whole. So thank you for listening to the presentation and thank you for your attention. If you have any questions or comments or remarks regarding this work, I would be very happy to answer them.